Hey guys, what's going on? It's Byrne from fixpectus.com, and in today's video what I'm going to talk about is treatment options for Pectus Excavatum and the different options you have and maybe hopefully give you some insight into what you should pursue. So when it comes to treating Pectus Excavatum, basically it can be summarized into two camps. You've either got the surgery or non-surgical methods. So let's start with surgery. There's basically two main procedures, the Nuss procedure and the Ravage procedure. But it's basically just the Nuss procedure nowadays. Back in the day, there were a whole bunch of other methods for Pectus Excavatum surgery, some crazy methods, and of which a lot were very unsuccessful. I've actually had a few clients from Eastern Europe and other places that got surgery 10 plus years ago, and their pectus is still just as prominent, and it really messed them up. So the surgical advancements, the Nuss procedure is pretty good. It has a pretty good success rate. Obviously, when it comes to surgery, there's always risks and complications, and the Nuss procedure is no different. So there definitely is some risks, and it is definitely a major surgery. It's putting a bar. So what happens is they make incisions on the side of your chest, and they will put a bar in, and that will pop your chest out, and basically immediately after surgery, your sternum and your chest will be a lot flatter, which is awesome. But the rehabilitation process, the pain is quite extensive. It was something I looked into as a kid, actually, when I was 12 years old, but at the time I was really into rugby union and was aiming to be professional at that. And it resulted in I think it was over a year, maybe 2 years of non-contact sport if I did the surgery. So I was it's basically written off there. And also in Australia, it was my parents, I don't think, could afford it. It was $10,000 or something crazy. So it's really expensive if your government isn't providing a healthcare that is included in it. I know some countries it is, which is fantastic, but in other countries it's coming out of your pocket, which can be really, really expensive too. So there is pros and cons to surgery. With people with pectus who have a really severe case and it is, compromising their heart or their lung function and causing some health concerns, then it's probably the option you would want to proceed with, because it is the option that is going to really elevate the sternum and change your bone structure through this surgery, okay? So in those instances, surgery can be very useful. But when it comes to someone who's just looking to improve the cosmetics, so improve their appearance related with pectus, it is a good option, especially in the severe cases, and obviously it does work most of the time. However, it is important to note that it seems very common. I coach so many clients out there who have had the surgery, the Nuss procedure, and after they take the bar out, their pectus actually reverts back in. So, and I also have a lot of clients who have had the surgery and they're still just annoyed by their rib flare and their pot belly, or they didn't push their sternum out as much as they wanted, and they're still just not happy with their appearance, so they still sign up with me. And that's the thing. Surgery will help with your indented chest, by pushing the sternum out, but it isn't going to address the rib flare, it isn't going to address the posture, and you're still probably going to end up being quite skinny if you are, because most people with pectus are, due to the correlation with Marfan syndrome and being ectomorphic, and that's not going to help with your body image issues or your confidence. So surgery or not, you need to be practicing the non-surgical treatment of pectus anyway, okay? So that alludes me into the non-surgical treatment of pectus, which is essentially exercising and stretching, but tailored for pectus, okay? So you guys have probably seen my videos, hopefully, on, exercises you can do, stretches you can do, but just to quickly summarize, pectus is basically always associated with poor posture due to tight chest muscles associated with the condition, which pull our shoulders forward, which makes the indent look a lot worse, If your shoulders are rounded forward like that, your indent's going to appear a lot deeper, whereas if you push your shoulders out and back, you're going to be pushing your indent out. So your pectus is going to look a lot better just in that position alone. And so the surgery won't address that. It's not going to address your posture. So what will is doing stretches to loosen up your chest and exercises to strengthen your back to pull you into that postural alignment. And that's exactly what my coaching and my programming does. So that's something you should be doing whether, you get surgery or not. That is something that is critical for Pectus Excavatum. You want to address your posture. On top of the posture, and then another element of pectus posture is the anterior pelvic tilt. This is often caused due due to, you know, modern daily habits, but this accentuates pectus because when we're in an anterior pelvic tilt position, we're actually going to be pushing out our pot belly and the rib flare, which I know for most people with pectus actually annoys them more so than the indent themselves, which the indent is the only thing that's getting addressed through like the NUS procedure. So it's not even addressing your rib flare and your pot belly. And so you need to be doing these exercises. You need to be strengthening your core to help with the anterior pelvic tilt and also to help with your rib flare and pot belly and to change that pot belly rib flare appearance into like a chiseled six pack, okay? So we need to be doing ab training and we need to be addressing that as well. Other things that cause anterior pelvic tilt is tight hips and quads. You probably do find you have that, so you need to be loosening them. I've got a blog on my website, fixpectus.com, if you want to check out some stretches. Also, if you sign up for coaching, obviously I provide you a stretching regime, so that's always an option too. So you need to be doing some stretches for your hips to loosen them up. And you also need to strengthen your glutes. That's also going to help with anterior pelvic tilt. Anyway, so that's the posture side of things, which you need to be doing. You need to be doing that, surgery or not. That is a treatment for pectus. That is going to make the cosmetics of your pectus look a lot better. It's going to pull you into alignment and make your indent less prominent, and if you have anterior pelvic tilt, it's going to make your pot belly and rib flare less prominent. Then it gets me onto the exercise side of things, where just building a muscular physique is so important for pectus. You know, building the pecs, building muscle in and around the indent, building a six-pack like I mentioned before, and just developing a physique that people look at and be like, wow, he is jacked, he has an amazing physique. They're not going to focus on your indent or whatever, they're just going to be impressed by your physique, and that also correlates to more confidence in your body, which is just so important, and it's going to make your pectus look so much less noticeable. When you develop your pecs around your indent, it makes your pecs just look big, and it makes the indent almost appear like it's caused due to you have bigger pecs, okay? It's quite interesting. I've actually been playing around with the vacuum bell, which I've just posted a video on, so you've probably seen that. And I'm almost not liking the fact that, so the vacuum bell is another method of treating pectus. That's essentially a suction cup that you can, it's essentially like this bell-shaped device that you put on your chest, and you apply, like, it applies pressure, it like suctions on, and it basically lifts your sternum out. So far right now, it's only like an acute change after I use it, but apparently overuse and over time it will change. So I'm testing that for you guys to, you know, really see my own data, but I have seen data that people do say it is a long-term change. So it would be something I'd recommend. If you are interested in getting a vacuum bell, there will be a link for one in the description for the one that I've got. So I think based on the data I've seen and based on my own experience, it is going to work and it will have some kind of effect. But nonetheless, I was totally getting sidetracked there. But what I was saying with the vacuum bell is it's pulling my sternum out for sure after I use it, but I almost prefer my body when my sternum's depressed more, because it actually makes my pecs, so by tilting my pecs, it actually makes my pecs look better and bigger. You know, like right now I haven't used the vacuum bell. I forgot to use it yesterday because I would keep forgetting. But and you can see, like, I still have that depression in my sternum, but it actually brings out the, you know, the separation and the lines in my pecs, and I like that. So again, that's another thing with bodybuilding. You know, it's really, you can really make pectus work for you by building your physique. But nonetheless, I know a lot of you do want that flatter sternum, and I totally understand. Obviously, different severities of pectus too. If you have a really deep one, obviously the more flatter you can get your pectus, the better. So the vacuum bell is another option that you could use instead of surgery to pair it with exercise and stretching, and you might find it's an ultimate combination of all three of those things to make your pectus a lot less prominent. So there is a lot of options to weigh out. Exercise and stretching are like non-negotiables. You have to be doing them whether you get surgery or not. The vacuum bell could be another tool that you add on to, you know, really try and get that sternum that bit flatter, or you could go the NUS procedure route if that's something you want. Personally, I'm not a huge advocate for it unless health is a concern, in which case then go for it, you know, consult your doctor, see what they have to say. But if we can address it without surgery, then why wouldn't we, is what I have to say. So yeah, definitely guys, exercise, stretching, vacuum bell or surgery, that can be optional add-ons, but exercise and stretching alone can get you great results. The vacuum bell can just add another element, also obviously so can surgery when it comes to the actual sternum. And yeah guys, that's kind of my video on, you know, Pectus Excavatum treatment. Obviously having pectus, I became obsessed with this, and having coached people with it for 5 years, I feel like I know my shit when it comes to treating it without surgery. And you've seen, hopefully if you've watched my videos, you would have seen, you know, like literally 50 plus client testimonials now. Like, it's crazy the amount of people that are changing with my training. So it really goes to show just how effective exercise and stretching is. And not many of those clients have used the vacuum belt. That's just exercise and stretching results. So it'll be interesting if I do start prescribing the vacuum belt to people, if that does add another element, but we'll see. Always trying to learn more, guys. I'm still in this to learn and, you know, find the best methods. Like, through coaching people over the last 5 years, I've refined my training program, and it's continuously getting refined, and I'm changing it to make sure that I'm implementing the exercises or the strategies or the sets, the reps that get the best results. So yeah, that's just my video on, you know, Pectus Excavatum treatment options. I hope that gave you, you know, some clarity on what you should be doing. Obviously there is a lot of information. If I was to go in depth on, you know, the specific exercises you should be doing for bodybuilding and everything, this video would be 5 hours long. But I have lots of different videos on YouTube, so check them out if you want more. You know, just go through my channel and find ones that seem applicable for you, stuff you want to learn about. Alternatively, I do have my coaching service, so just go on to my website, link will be in the description, book a call with me, and then I will do everything for you. I'll program everything for you and you'll be good to go. But yeah, anyway, thank you so much for watching this video. I hope it was helpful for you. If you did like it, give it that thumbs up. If you are part of like any Pectus Excavatum pages on Facebook or whatever, share it if you think it's going to help those other guys in those pages. You know, share it on Reddit or whatever. Get the video going around so we can help more people. Any questions, comment below any questions you have for me. You can always email me, riley@PectusPT.com. And if you really do want to transform, my coaching is definitely what I would recommend. Thanks guys, bye.